HIV is a disease that it doesn't really manifest itself when you're infected, so you could be infected without knowing it.
In the UK, between 25 to 33% of people who are living with HIV have no idea that they're HIV positive. We know that from Health Protection Agency statistics.
The thing with HIV is, and not a lot of people realise this, is the way that the symptoms that it presents are very similar to that of a bad cold or flu, and in fact in some people it doesn't even present any symptoms. So it can often be missed, and even by sort of general practitioners as well.
It's the first time ever in England that we've had a national testing week. So the week running up to World AIDS Day, we're asking as many people to consider having an HIV test as possible. So we've done lots of different targeted campaigns in the past, but we've never had a whole week which is dedicated to raising the profile of HIV testing and saying to people, consider a test, have a test, or pledge to test.
The reason it's so important for people to take a HIV test is it's more important for them to know their status rather than not knowing the status because of their long-term health implications.
Certainly, it's definitely better to know, know what your status is so that you have better control of your own life.
Unless you have had an HIV test that confirms that you're either negative or positive, you don't know that you cannot know your HIV status.
It is part of knowing you're healthy and planning forward, and also preventing the further spread of HIV and AIDS.
You're actually empowering yourself. You're taking responsibility, not just for yourself, but also the responsibility of not passing it on to other people.
The earlier HIV is detected, the better.
An early diagnosis will lead to better health care and a more favourable outcome.
The more it's left untreated, the more damage it does to the immune system, and then the more complications there will be further on in the treatment of the HIV.
The later somebody's diagnosed, the more damage there may have been to their immune system, and the more likely they might have to have other complications. So we very much want people to test early, test regularly if you're having unprotected sex after one negative result, but you cannot overstate the benefits of testing early for HIV.
I have come across, from when I used to work in the GUM clinic, people who were late diagnosed and they've had more opportunistic infections, more health issues, and their long-term outcome hasn't been as favourable as somebody who's been diagnosed early.
When you go late, it's really a problem, and only you have a lot of you are down, and a lot of medication will be given to you. You need counselling, but because of that illness, you'll not be able to cope well.
The benefits of early diagnosis is it can make a positive change to your life. Because before HIV testing, most people are negative about sexuality, that is intimacy, relationships, or even life. But after testing, one can make a change, whether positive or negative. It is a step whereby you start to make a change. We've seen it happening.
Over Manchester Pride 2012, we were out on the street talking to gay and bisexual men, or men who have sex with men, to sort of try and gauge why, if people were testing, and if they weren't, why they weren't testing.
The reluctance is still around. They sort of think we can never get life insurance, we can never get a mortgage, we've got to tell people. There's also that fear, what do you do with that information? And it's telling other people who are in their lives as well. They may be scared how people will react.
They thought, if I go for testing, that's the end of it all. I'm already dead.
I mean, I suppose there's the fear factor involved with HIV, but I think that's predominantly in a slightly older generation of people. I think within younger generations, certainly my generation, I was born in 1986, which was when the epidemic pretty much started, and whilst I've got very vague recollections of sort of government campaigns and whatnot during the 80s and early 90s. For the most part, my generation hasn't seen that, and a generation below me hasn't seen that. So there isn't that fear. And also, in terms of my generation's experience of HIV, for the most part, no one will have had friends that have died, whereas older gay men most likely or are more likely to have had friends affected by HIV and maybe passed away because of HIV before treatments improved. So I think there's a sort of lack of knowledge, and not through anyone's fault really, but a lack of knowledge and direct experience of HIV is one of the key factors.
With Africa, when HIV was first discovered, there were a lot of negative stereotypes and perceptions from the media. For example, adverts with skeletons depicting people dying, and it was all negative, and people shunned testing. And
They think if I have an HIV test, they'll tell me my results are positive and I'll die soon, but that's not the case.
People think it's not as bad as it is. And also, again, with the medication out there, people think, right, okay, I can just pop a pill and everything will be fine, and it doesn't really work that way. And
I also think for people with busy lives, it's a convenience thing. If you go to the sexual health clinic, it's a half day out of your working week, and some people have said to me, the company I work for expect me to take that as part of my holiday, or etc. And so it's just that inconvenience, it becomes a barrier to going to get tested. And it's not that those people don't want to get tested, it's just that it's just another thing to do within their busy lives, I think.
Many people are reluctant to have an HIV test, and again I think there's a number of reasons. People may not see themselves as having been at risk. That might be because they've just had one sexual partner, or they might think they've had a number of sexual partners but none of them have put them at risk of HIV. If you have had sex and you don't know somebody's HIV status, then you should have an HIV test to confirm your own status.
it is the fear of the unknown, in that people are negative about being positive. At times it is stigma and discrimination, whereby people are, according to their experiences, they have seen how people are treated and labeled when they have tested HIV positive.
HIV is a disease of stigma and discrimination, so we're not saying it's easy and it's routine and it's great to be HIV positive, so I think that links in as well. I think that it's not the easiest test for people to take.
I mean, in terms of my experience working within the gay community, the HIV message seems to be out there. I mean, if you pick up national publications such as, Attitude magazine, Gay Times magazine, they have columns written by HIV positive people, and they have regular features about HIV as well. So, those are obviously going into the hands of that community. And there are still events. I mean, World AIDS Day is still marked in most cities with a gay community, and within other communities as well. So I think the message is still out there, but I think it's trying to strike a balance, isn't it, between it being a message that strikes fear into people, which scares them into going to get tested, but on the flip side, that increases stigma against people living with HIV. And then on the other side of it is the message that, living with HIV is, for the most part, is achievable these days, and living healthily is achievable for most people. And it's kind of, where do you find that balance within the message that you want to give out that kind of makes people go, oh yeah, I need to go and get tested to make sure that I'm okay.
Sylvia Protetti, an openly positive woman in London, would say there's never been a better time to be diagnosed positive in the UK today. You will live a long life with HIV, with access to the HIV medication when you need them.
I mean, I think a lot of people are aware now that HIV is a treatable illness. I always say to people, it is treatable, but it's not something you want to go shopping around for.
There is life after HIV, because it's just a condition like any other disease. I've seen a lot of people after testing, they are living. more than people who are negative.
If you are tested HIV positive, that's not the end of the world. I mean, there is a lot of care in the UK, everywhere. Even at home now we access care, so you have better chances of living a quality, longer life.
It accelerates your attitude towards life. As some people live 15 years before commencing ARV treatment, 20 years before ARV treatment, they are living with HIV because they've adapted like positive living.
I tested about 15 years ago. I got my results that I was HIV positive when I was really young, but I've been able to cope with HIV. I'm doing well on my HIV medication, and I'm doing everything normal than any other person.
You are still like any other person out there. You are still entitled to employment, having relationships, starting a family, and it also helps you to further plan your life, like in terms of finance and in terms of health. They are more geared to living well.
It is treatable, and people are living happy lives and are working and for the most part healthy. But early detection is really important, because then your consultant can monitor the progression of the HIV virus and can then look at when is the appropriate time for you to go on to medication.
It's important to emphasise that everybody who needs HIV medication in the UK gets them, irrespective of immigration status, visa status, no visa. Everybody gets HIV medication.
In Africa we say a child who doesn't cry dies in depression. It's like you are living in a shell. You have to come out of that shell and know who you are, knowing your status, like so that you make the right decision or the right choice, or you live positive.
My message to people out there is to get tested if they've put themselves at risk, or if they have a really active sex life. I think it's very important.
It's better to know your status than not know your status. It can take minutes to do. There's nothing to be scared of. It's for your health, and you're responsible for your health at the end of the day.
I get my teeth done. I go every 6 months for my checkup there. At the same time, I go to the sexual health clinic and have a sexual health screen. And that's the way that I view it. I'm trying to normalise it as much as that for people. And when I do work with young people, because I do a lot of work with young people as well, is that's the message I try and get over to them. I try and talk about it openly and frankly, so that it's not this taboo subject.
It doesn't really take up a lot of time if you consider that it's going to be really, really good.
People always say prevention is better than cure. It's sort of a prevention mechanism. Why be negative about being positive? Make the right choice, go and test so that you make an informed decision about your health and your life. Take an HIV test.
Take a HIV test.
Take an HIV test.
Take a HIV test.
Take an HIV test.
Take an HIV test today.